Hi, my name is Michelle, and this is going to be my cardiovascular assessment video. This is my patient.
Hello.
So upon doing the cardiovascular assessment, I would walk into my patient's room and I would introduce myself, wash my hands, and tell the patient what I'm going to be doing today. So I'd come in and wash my hands and I'd say, hi, my name is Michelle, I'm going to be your nurse today. How are you?
I'm doing good. How are you?
Good. So today we're going to do a cardiovascular assessment. So I'm going to take your blood pressure and your pulse first, and then we'll go through all of your pulses throughout the body and take a listen to your heart.
Sounds good.
So now I'm going to take my patient's radial pulse. A good way to find the radial pulse is with a thumbs up, because radial is always for rad, so it's always right along the thumb line. So locate it, and then look at my second hand watch, and you want to measure for 30 seconds and then multiply that by 2. So within my 15 seconds, I got 30. So multiplying that by 2 would mean that my patient has a heart rate of 60. A nice healthy resting heart rate for a patient of this age would be 60 to 100. So he's very athletic because he's more on the lower side, which is great. So now I'm going to take his blood pressure. So you want to have the patient have their legs down, not crossed, and you want to have the arm level with the heart. I got 115/70, which is great. So the next part of our assessment would be to assess the arms and the temperature of the arms and hands. Whenever inspecting, you always want to make sure that you do this bilaterally so you can tell if there's any abnormalities between both arms. You don't want the skin to be too cool or too hot. So I would inspect both of his arms. There's no edema present and nothing is standing out to me. And you'd want to feel up both arms. Make sure that all the temperature feels the same and there's no marks or anything that looks out of the ordinary. So the next part is to also assess the other pulses throughout the body. So you have your brachial pulse, which is over here. You have the radial pulse, which runs along the thumb. Ulnar pulse is on the inside, and these are measured from 0 to 3, 0 being absent and 3 being bounding. 1 would be weak and 2 is normal. You also have other pulses throughout the body. Behind the knee, you have a popliteal, and then on the inside here, you have the posterior tibial, and on the foot, you have the dorsalis pedis. I want to inspect the epitrocular nodes, which are on the inside of the bicep, and these drain the ulnar, which is down here. So you'd want to look out for any redness or tenderness, any swelling, which this patient doesn't have. And you want to always remember to do it on both sides because one could be a little tender and one could not. Next, I'm going to perform the Allen test. What you do for this is you occlude both arteries of the ulnar and the radial, and you would have the patient open and close their hand while I'm occluding those arteries, and then have them keep their fingers upward and you should see blanching. So I'm going to explain to my patient the process. I'm going to occlude both arteries, and then I'm going to say, please open and close your hand a few times. Good. as you can see, there's some blanching. It might be hard from afar, but there is some redness that appears and then disappears. So the next step is to inspect the legs. You do this the same way as the arms. You would inspect the skin if there's any abnormalities. Next, you would inspect the legs. You would do this the same way as the arms, doing this bilaterally so you could see if there's any abnormalities. You want to feel for temperature, inspect the skin. You could also look for any superficial phlebitis in this part, which is just swelling, redness, and hot to touch. So you just go down the leg and you would feel for this. Everything feels normal. There's no edema. It's not hot to touch. Everything seems okay.
So professional.
Okay, so the next part of our assessment is to do the inguinal lymph nodes. This could be awkward, so you want to make sure that your patient knows exactly what you're feeling for and where you're feeling for them. So you could show them on yourself that the inguinal lymph nodes would be around here in the pelvic region. And then again, you would just feel for any tenderness, just to see if there's any signs of infection, things like that. So the last part of our assessment for the legs, you would want to check for the Hoffman sign, and this would give you an indication if the patient had a DVT. So for this, you would see redness, a lot of edema and swelling, and when the calf is extended, it would be painful. So you would always probably be able to just tell by looking at either leg, because both probably, you could tell the difference between both of them. But you can have the patient extend like a 90-degree and see if there's any pain in the calf. And you would also, of course, inspect for that swelling and redness as well. Region. You want to observe the carotid arteries, and basically what you're looking for is to see if there's any bulging or if you can actually see any type of bounding pulse. And do this bilaterally, of course, and both look normal. Next, you want to palpate the pulse. So, good. Everything feels normal on this side. And you'd also want to do the other side, but you want to make sure that you never palpate them both at the same time, because then the patient can pass out. Good. So next I'm going to auscultate, and you want to listen to these with the bell. What you're looking for is to make sure that you don't hear any brooding. Good. And with the neck, you also want to inspect the jugular veins, again, to make sure that there's no distension, and you would inspect on both sides. Okay, so next we're going to do our inspection and auscultation of the pericardium. So what you want to do, whether the patient is in a gown or not, it would make it easier to inspect the skin and stuff. But you could always just tell your patient that you're going to take a look. And you could also palpate at the same time. So you can go down the sternum and make sure that you don't feel any tenderness and there's nothing that looks out of the ordinary there. Then you're going to listen to the 5 parts, anatomical parts of the heart. So first you have the aortic over here. You have the pulmonic. Then you have the Erb's point kind of in the middle. You have the tricuspid, and then you have mitral. And when you listen to the mitral, you can also get the apical pulse, which is down. So you want to also listen to these both with your, and you want to listen to these points with your diaphragm and your bell as well, because the bell can identify any heart murmurs. So first I'm going to listen to the aortic. And all of these sounds should sound like a nice lub-dub. Pulmonic. Erbs. tricuspid, and mitral. Good. Now I'm gonna listen with my bell. So you also want to make sure that you listen to the apex and the base of the heart. So I'll do that in a moment. And you want to identify S1 and S2. So that's that lub-dub sound. You want to make sure that that's nice and clear. And when you're done with your cardiovascular assessment, you always want to thank the patient for their time and wash your hands before exiting the room.